So, caregiver guilt is really the idea of that they're the family members try to do the best they can to help the patients, and what they try to do is always say that the patient's needs and issues are number one, and which is of course understandable. But I think what is also less emphasized to the caregiver is that you need breaks. It's understandable if you get frustrated. It's understandable if you feel tired and you wonder how much longer can I go on keeping up this pace and always being worried. Um, and that I think having those thoughts and feelings are okay. That's normal. That's natural. And that if they think that there's something wrong, thinking that way, they're just going to feel more guilty, and it's just going to make it more difficult for them psychologically as well. So I think that normalizing those thoughts and not saying that that's common, that's understandable, I think potentially helps them in terms of their approach to how they care for them, because they know that this is for the long term. It's not just, oh, well, they're with me for a week, and after the week is done, they're with them for the long haul, for whatever the outcome is. And so I think sometimes it's overwhelming, and it feels like, is there ever any time for me, and can I think? Is it okay for me to think? What about having some me time? And I always tell patients and their family members, it's okay. It's okay. You need to recharge. You need to sometimes take time for yourself, and that you need to be on your best, be at your best. So if you need to take some time away, that's okay. There are caregiver support groups, specifically just for the care groups. And so the patients are not there. And when the patients aren't there, then they feel free to kind of say things that they certainly would not want the patients or the people that they're caring for here. So I think that, again, I think a lot of those thoughts that they have, they feel like I should not be thinking them. And that's where the guilt comes in. I think expressing it to other people that are feeling similarly, I think, is a huge release. And when caregivers can come together and have that kind of discussion, and how do you deal with this? How do you deal with that? Oh, I'm dealing with this now. How did you handle that? I think it's tremendous. I think one of the approaches, or one of the things I make clear to patients and their caregivers about support groups, is what they're going to provide and the format. And I think that when I say to them, this is if this appeals to you, if you find value in sharing your story, if you find value in exchanging information, receiving information in a community, if seeing other patients that are going through what you're going through is of value, then you will certainly get a lot of benefit of it. I agree with you that sometimes, there are going to be some patients who just feel like that format that of meeting in that way is not beneficial to them. So I certainly don't make it you have to go, or there's something wrong if you don't. It is a resource ultimately, and when you tell them this is what is to expect to get from it, they will make their own decision as to whether that's worth their time. And I think that if they already know that they wouldn't benefit from that format, then they won't make that extra effort to feel like it was wasted.